Hello and welcome to Hudson Health. My name is Dr. E.J. Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJBarnabas Health. And I have with me today my co-host.
Hi, my name is Dr. Angel Lazo, and I'm with RWJBarnabas Health at Exchange Place. So today we have Dr. Sadek, bariatric specialist, going to come and talk to us about their program.
So Dr. Sadek is starting a brand new program at Jersey City. We could not be more excited. He has started several bariatric programs around RWJBarnabas Health Enterprise and really brings a wealth of knowledge, several years of experience. And, you know, this is a very interesting topic because everybody's talking about weight loss, whether we're talking of Ozempic or weight loss surgery or celebrities using different modalities. But at the heart of it is that it's not just about how we look, right? We want to talk about bariatric health and metabolic health, about our health, reducing diabetes, cholesterol, heart problems, cancer. So I'm making sure that our community has access to all the tools that they need to be healthy.
And it covers from A to Z. In other words, he's going to discuss, you know, from the inception of the consult all the way over to actually post-op period, you know, so it's a whole journey. So we'll be right back.
No one plans on heart disease, but everyone should have a plan for it. We help patients of all lifestyles and medical histories plan for healthy hearts. We offer convenient screenings without judgment, hundreds of preventive programs, and women's heart specialists. And we're the largest cardiac surgery program in New Jersey. Make plans for a healthy heart with RWJBarnabas Health. Let's be healthy together.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Hi, everyone, and welcome back to Hudson Health. My name is Dr. Angel Lazo. I'm with RWJBarnabas Health at Exchange Place, and I'm here with my co-host, Dr. Akunyili.
Welcome back, everyone. I'm Dr. E.J. Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJBarnabas Health. And we're really excited that we're going to be talking to Dr. Sadek, who is one of the premier bariatric surgeons in the country. And, you know, couple of things I think people wonder about. What is bariatric surgery? And what kind of modalities? And which one works for me?
Yeah, I mean, most patients really think bariatric surgery is the equivalent to surgery, but it's really not. It's a program. I mean, it involves the patient. It's patient-centered. Talk about nutrition, some of these psychiatric issues that sometimes people have with binge eating and so on, so which are interesting entities to identify, especially if someone's actually seeking to lose weight.
It's a whole person approach.
Exactly. You know, and again, the metabolic diseases now are really a big deal, especially with the obesity going on in this country. You're talking about not just obesity, but you're talking about pre-diabetes with increased risk for heart disease. You're talking about diabetes, which is the equivalent of heart disease. And this is actually one of the modalities that actually even cures diabetes, an example, fatty liver. So he's going to cover the whole gamut of the program to include even the different modalities that they have. And especially him who does laparoscopic special, you know, procedures. It's incredible what he's able to offer here at Jersey City.
So this is very exciting. I can't wait for this. I'm going to tell you a little secret. So you all know I'm an emergency physician, but did you know I was also certified in obesity medicine?
No.
Yes. You know, I've been always fascinated. So if you understanding obesity medicine is really understanding human physiology, and then you understand why it's so hard for certain people to lose weight, whether it's hunger signals to the brain or gut health, etc. So he's going to talk to us about some of that. And of course, we cannot have this segment without asking about the GLP-1s, Mounjaro, Ozempic. Everybody's talking about that, Dr. Lazo, right?
Yeah, and again, those medications have its, you know, they have their role. But again, the program is a whole program. You know, in other words, different types of surgery, you know, you're followed religiously, you follow the nutritionist. Because again, it's not just the weight loss, it's actually the weight maintenance. And again, this is where some of the, for example, like the GLP-1 class, not only do they help, for example, with weight loss, but they also have some of them, and specifically, say for diabetics, some of the GLP-1s are not just great for diabetes, but they're also good for weight loss, but they're cardioprotective. In other words, your journey as being an overweight or obese patient is a lifelong journey. It's very similar kind of to alcoholism. You know what I mean, where it is a disease, you know what I mean, and you have to address it, but you have to address it every day. So for the patients that are really motivated, the bariatric program here now in Jersey City is going to be phenomenal.
But I think we've made strides in medicine, and Dr. Sadek could touch it. I'm thinking of obesity not as a flaw, but really as a chronic disease, like every other chronic disease, and giving the patient multiple ways to overcome it, right? If somebody has a ruptured appendix, you don't think of it as their fault. But I think even in medicine, it took us a while to get past that human flaw at the basis of obesity. I think we're finally moving away, and the science is definitely moving away from that.
Yeah, and I mean, we got an incredible obesity pandemic. I mean, we already know the risk stratification that this means for the patients, you know what I mean, as far as heart disease and so on and so forth. So this is very important to be able to have these programs and offer it here in this community.
Right, and we're going to ask him, to your point, about obesity, not just as one disease, but as a program for other disease, whether it's heart disease, as you mentioned, or diabetes, or even cancers, or depression, all linked to obesity, which is prevalent, right, in the American population.
Yeah. And again, I mean, imagine there's a cure for diabetes. You know, if you're significantly overweight and you have significant comorbidities, you know, bariatric surgery could actually cure your diabetes. But again, it's just incredible the amount of risk that a lot of patients have in our community. And now we're able to offer even more to decrease their risk and basically change their life, because this is really a lifestyle modification and a life-changing procedure. You know, we already know the risk for example, obstructive sleep apnea, you know, increase in death, premature death, et cetera, et cetera. So it's unbelievable that it's not just a treatment, it's actually curing some diseases.
And what I like about this program, it is a whole program. There's still physical therapy that talks to people about healthy exercise. You have nutritionists that talk to you about diet and healthy eating, etc. So I think having that whole picture all under one window, like many things we've talked about, is the key to success for our population who are disproportionately affected by obesity.
And again, even the simple things, even the very simple things like lifestyle modifications are still cardinal in all of this. So.
Absolutely.
But it's going to be incredible. It was an incredible.
I cannot wait to hear what Dr. Sadek has to say.
Yeah. Well, let's bring him in. We'll be right back.
Comprehensive healthcare is here, here, and here. RWJBarnabas Health is healing, enhancing, and investing in Hudson County with its two newest locations, Hoboken and Exchange Place. Within walking distance or accessible by mass transit, our locations combine convenience with primary and specialty care, including cardiology, women's health, orthopedics, cancer care, and more. Let's be healthy together.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Hi, everyone, and welcome back to Hudson Health. My name is Dr. Angel Lazo, and I'm with RWJBarnabas Health at Exchange Place. And I'm here today with my co-host, Dr. Akunyili.
Hello, everyone. Dr. E.J. Akunyili, and Chief Medical Officer, Jersey City Medical Center, a facility of RWJBarnabas Health. And we have the pleasure of introducing Dr. Ragui Sadek. Good morning. Hello. Tell us about yourself.
Good. My name is Dr. Ragui Sadek. I'm the Chief of Bariatric Surgery at RWJBarnabas Health. I've been in practice for about 20 years. I do minimally invasive surgery, advanced endoscopy, bariatric surgery, weight loss, and all the advanced robotic and laparoscopic procedures.
So excellent. Tell us a little about your program. Tell us about who's a candidate. What's bariatrics about?
And this is a brand new program, right? Especially at Jersey City Medical Center.
At Jersey City, it's a brand new program. We're building one of the state-of-the-art program across the Barnabas healthcare system. We have built many programs. It started with the Hospital of Robert Wood Johnson in New Brunswick, and then spread across the system. When you talk about a state-of-the-art program, you talk about how to prepare a patient before surgery what to take care of during the operation, and how to manage the patient after surgery. It's not just an operation, it's a whole process that starts before and after the procedure. Weight loss and metabolic surgery has been one of top 3 surgeries that are deemed by the American College of Surgeons as a life-changing operation. It increases longevity, takes care of complications. The top 3 surgeries to be performed are cardiac, cancer surgery, and bariatric surgery. A patient who's overweight will have 10 years less to live than a patient who's not overweight. So this is huge. It impacts the community, impacts medical diseases. It cures a lot of healthcare problems like diabetes and hypertension, sleep apnea, and so on and so forth. I'm very excited to start the program at Jersey City Medical Center. The hospital is amazing. It's got all the necessary specialties that we need. Surgical ICU is present. All the medical specialties are present. Doctors are great. Operating room is top notch. And we just bring in our expertise, and I'm bringing 20 years of experience to Jersey City Medical Center.
We're very excited you're there. And I know people in the audience today are wondering, like, what specific types of surgeries do you have? I mean, I know there are different modalities. Just tell us more about 1 or 2 of the procedures that you do.
So basically, in weight loss or metabolic surgery, we work on the gastrointestinal system, and we modify the gastrointestinal system one way or another. We've understood over the years, and we as surgeons for the last 50 years have studied the gastrointestinal system and its effect on metabolism, and we have recognized the importance of the gastrointestinal system, the hormones that are secreted from different parts of the GI system, how they affect obesity, metabolism, physiology, and so on and so forth. So surgery is really designed to alter for the better the gastrointestinal system. What I mean by that is, let's say, for example, an operation called a gastric sleeve operation, which is the most commonly done weight loss operation in the United States. We reduce the size of the stomach, which in turn reduces the hunger stimulation, reduces the caloric consumption by the patient, and this leads to patients eating less, feeling full faster, and losing weight faster. Another operation is called the gastric bypass operation, where we basically alter the GI anatomy in such a way that even when patients are eating a certain amount of food, not all of it gets absorbed. I just want to make sure that patients understand that when we say a malabsorptive operation, we're not saying that the patient is going to have malabsorption of nutrients. They will not absorb calories, but nutrients, for the most part, remain absorbed appropriately, and the patient does not get malnourished.
It's very exciting. Now, I know we might want to start the segment, but definitely not finish. The question everybody's asking is, why would I have surgery versus weight loss drugs?
And that's a great question. And that's very important for patients to understand that every modality has its place, and not every size, it's not one size fits all. If you're a patient with a body mass index, and body mass index is basically height and weight in a certain formula, gives you a number. It should be a 26, which is a normal. Anything above 30 is considered obese. Anything above 35 is morbid obese, and we go up. So if your body mass index is about 45 or 50 and you have diabetes, high blood pressure, heart disease, sleep apnea, fatty liver, things like that, and you want to lose about 100 pounds to get into a healthy state, you're not gonna achieve that with a medication. That's based on the studies. And the data and the studies have shown that you'll lose about 14% on average of your extra body weight. So if you're 300 pounds, you lose about 40, 50 pounds, you're still at a body mass index of about 40 at 250 pounds. You're still not at your goal. Yes, you've achieved something. Yes, you've lost weight. Yes, you've decreased risk, but you have not achieved your goal to become healthy and to decrease your cardiac risk. On the other hand, that patient will probably benefit more from an operation that can help them lose 100 pounds and decrease the risk over time. On the other hand, if a patient wants to lose a few pounds, 20, 30 pounds, with some comorbidities, they may benefit from the medications.
Yeah, we're going to go to break right now, but when we come back, I want to go over, say, from the very beginning of the evaluation, who qualifies, all the way to the post-op period. So we'll be right back.
No one plans on heart disease, but everyone should have a plan for it. We help patients of all lifestyles and medical histories plan for healthy hearts. We offer convenient screenings without judgment, hundreds of preventive programs, and women's heart specialists. And we're the largest cardiac surgery program in New Jersey. Make plans for a healthy heart with RWJBarnabas Health. Let's be healthy together.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or a quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Hi, welcome back to Hudson Health. My name is Dr. Angel Lazo. I'm with RWJBarnabas Health at Exchange Place, and I'm here with my co-host, Dr. Akunyili.
Hi, I'm Dr. E.J. Akunyili, Chief Medical Officer, Jersey City Medical Center, and we're here with a fascinating guest, Dr. Sadek. We'll let you continue talking about all things weight loss. I know we ended that last segment talking about weight loss medication and the patient journey. So I'll let you start.
So basically, when we determine who's a candidate for surgery or not, it really works what we call body mass index. And body mass index is as we talked, is a formula where you put your height and weight, and you can look that up online. It gives you a number, and 26 is the upper end of normal. If you're between 26 and 30, you're considered overweight. If you're between 30 and 35, you're considered obese. 35 to 40, you're obese category 1. Above 40 is obese category 2, and then 50, and then 60, and then we keep going, and it's obese category by BMI. As it stands in the United States, patients with a body mass index of 35 and above are candidates for weight loss or bariatric surgery. As we looked in the data, we realized that patients with body mass index of 35 will benefit better in long term from a weight loss operation than any other modality. Currently, there are some other choices in the medical world, namely the GLP-1s or the medications, the injectables, the Ozempic, Mounjaro, and all of the other ones. These medications work in a certain situation. They work in patients with lower body mass index who are looking to lose 30 pounds, 40 pounds. They don't have significant or severe medical problems. Or diabetics, but smaller body mass index who are not looking to lose a significant amount of weight. But if you're a patient who's looking to lose significant amount of weight with significant comorbidities, heart disease, or high risk, you may consider surgery because it may be the better option on the long run. One thing also we need to touch base on is if you're taking a medication, you need to take it for a long time, because if you come off the meds, there is a chance you regain some of the weight back. The data or the studies from the pharmaceutical companies showed that about 40 to 50% of patients regained some of the weight back, and some regained majority of the weight back when they stopped the medications. When patients call our office and come to our office, we start the journey with them. It takes about 3 to 6 months, depending on their insurance company, but they go through a process with a nutritional evaluation, a psychiatric evaluation. It's really not a psychiatric in a sense of, sitting on a couch and talking to a psychiatrist. It's more like to determine if there's any eating issues or, behavioral issues that we can correct prior. And then they go through a process of evaluated by a cardiologist or a medical physician, and then they go for the surgery. And then we follow the patients after. I tell patients you will follow for life. As long as the patient is willing to come for follow-up, we're going to follow them.
That's a neat thing about the bariatric program that you have, that you've been so successful, because it really is like a team approach. And again, I know you and I have discussed this, it's not just loss of body weight, but it's actually maintaining that body weight. So it's the surgical approach together with, the nutritionists, the internal medicine doc, and then again, some of these medications to be able to actually keep them, at the ideal body weight.
Correct. And we can use everything in conjunction. I mean, again, like I said in the beginning, it's not a one-size-fits-all. There are some patients who will benefit from surgery, and then we'll add some medications for some time to help maintain even more weight loss. Or there are some patients that we may put them on the meds prior to an operation, make them safer for surgery. Or we can use everything, we can use a combination of all. But the team approach to the obesity problem is the best way to manage it and the best way to ensure success. And as you mentioned, it's maintenance of the weight loss, not just losing the weight, but how long do you maintain that weight loss, and which helps you mitigate the cardiac risk.
And I think it's not just looking at obesity as an isolated condition. Obesity is really a constellation of other conditions, right? Or it's other conditions that are made worse by obesity, and the weight loss surgery or weight loss drugs in combination with surgery should help all those conditions. What do you think about some of those?
And I think I agree with you, and how we should approach obesity. It's a chronic condition. It's a significant medical problem. It affects patients and people's lives. It decreases life expectancy. It leads to some serious medical problems. Obesity has been linked to cancer, has been linked to autoimmune diseases, have been linked to uterine cancer in females, breast cancer at times. Heart disease, or the big one. And diabetes is not a simple disease. I mean, diabetes on the long run leads to all the complications of diabetes. I mean, do we know that the number one cause of blindness in the US is diabetes? So there is a way to cure diabetes by an operation. We're not treating it, we're actually curing it, where patients after surgery will have a normal hemoglobin A1C and have normal sugars. So we use all that in conjunction to get the patient to a healthy state.
And a lot of these metabolic diseases are really, decrease in life expectancy and so on and so forth because of what they do. And again, for weight loss, it's the maintenance. And again, what you really want to lose is that visceral stromal compartment, which is really the bad fat.
Correct.
That's the one that we really want to
Correct.
use. So between the surgery,
Correct.
which is the number one for that, and then maintaining it with lifestyle modification is really what gets the patients. But we can't thank you enough, Dr. Sadek. We definitely have to have you back. We'll be right back.
Comprehensive healthcare is here, here, and here. RWJBarnabas Health is healing, enhancing, and investing in Hudson County with its two newest locations, Hoboken and Exchange Place. Within walking distance or accessible by mass transit, our locations combine convenience with primary and specialty care, including cardiology, women's health, orthopedics, cancer care, and more. Let's be healthy together.
Hi, everyone, and welcome back to Hudson Health. My name is Dr. Angel Lazo. I'm with RWJBarnabas Health, and I'm here with my co-host, Dr. Akunyili.
I am Dr. Akunyili. Welcome back to Hudson Health.
That was a great chat with Dr. Sadek.
We have to have him back.
Yeah.
We could have continued for another hour. So I think what's fascinating about what he said is just there's not one size fits all. And you have to really, like many things in medicine, think of the patient's risk factor, the degree of obesity, whether it's just the BMI, which is not a perfect measure, but which is a sort of approximated, whether it's 26 to 30, and what you do for that in 30 to 34 and 35. And of course, he talked about weight loss drugs, which is what everybody's wondering about.
No, it's very, very, very exciting to actually have that. Because it's not just Dr. Sadek, it's actually his team.
Yes.
He comes with a whole team.
Absolutely.
And with over 20 years experience. And he himself actually has with minimally invasive procedures for bariatrics and so on and so forth. I mean, it's just really nice to hear, from the very beginning, from the inception of the program, and he talked about leading it all the way past even post-op. Because again, it's a journey. And again, the patients want the weight loss, but the bariatric programs, like Dr. Sadek, is interested in not just the weight loss, but also the maintenance. Because
he said it's a lifelong journey. They will follow the patient for life, which
Absolutely.
is, there will be ups and downs and setbacks, but the fact that they have different patients continue to maintain or come back. So I know everybody's asking about this. What did you make of the interplay between weight loss drugs, the GLP-1 inhibitors, Ozempic, etc., and weight loss surgery? That's $1 million question out there.
$1 million. And again, everybody and their mother's asking that question right now. But again, look at Dr. Sadek's approach, because the patient approaches it kind of like from an aesthetic point of view, from the looks, I want to look skinnier, et cetera, et cetera.
But we know obesity is
But
not
we
about
know
the
obesity
looks.
is not about aesthetics. Obesity is about disease and with significant risk factors. What you see aesthetically, the subcutaneous tissue stuff.
It's not about looking like a Hollywood
immunologically.
celebrity.
That's
None of
correct.
that.
But again, the bariatric program, whether bariatric surgery is indicated for you or not, does encompass everything. And again, this is why the surgery is so successful. This is why the surgery actually reverses and gets rid of diabetes, because you get rid of that visceral stromal fat, which is really the one that's actually immunologically, is the one that's given heart disease and so on and so forth. This is why it is a commitment. It's very patient-centered. In other words, you see a psychiatrist and so on and so forth, and you don't see the psychiatrist like he explained, because you have mental issues or whatnot. But there are issues, for example, for individuals that have more of an appetite, for example, that have binging as a problem and so on and so forth. So it's not just eat.
Or emotional eating.
Exactly. So you cover all the bases. You see the gastroenterologist. The process is anywhere from 3 to 6 months, so to speak. We like it to be a little bit more like the 3-month, but again, a lot of that is contingent on, on insurance. But when you have a motivated patient, with a success record, track record like Dr. Sadek's practice, now coming to Jersey City Medical Center, it's an incredible missing piece that we have here, especially with, the hopes of, doing a cardiometabolic center even at Hoboken. Our Hoboken hub has everything. It has cardiology. So we have a lot going on here in Jersey City.
And we've always, you and I have prided ourselves in talking about access to high quality, equitable medical care right here in Hudson County. Yeah. So to have this close to home, not just Dr. Sadek, like you said, but his team and the entire suite of things they can offer. So for some people, all they will need is the weight loss medications. For some others, it's just lifestyle modification. Yeah. It's a combination of both for others. Yeah. And the successful track record. And again, we talked about this in the intro. Obesity is not just about one disease. It is a constellation and a program for different diseases. So if you can cure obesity, you can cure diabetes, which is the number one killer.
And again, they even specialize in some of the complications, you know what I mean? For individuals, for example, with significant weight loss. For example, you can end up with gallbladder disease, you can end up with gallstone disease. Again, this is true not just of bariatric surgery, but again, even the individuals that are on GLP-1 therapy as an example. So they're very familiar with all this. This is basically what they do, So now they have the whole program. We have the whole program here actually in Jersey City with over 20 years experience.
It's good to hear him, because I think people out there think of surgery and there are all these TV shows, you know them, I don't.
Yeah.
And people have that image, almost that caricature of what you have to be to get surgery. Yeah. But really, it's very individualized, and you need to get access, and sometimes it's just risk factors or significant risk factors. So somebody might be 300 pounds and somebody else might be 500, but they have different approaches depending on other comorbidities, right?
Yeah, and again, it's a patient-centered, so it's shared decision-making. So again, you're seeing your bariatric team, but it's specialized in the care for you, depending on your, like you said, your body mass index, and then your risk factors. So those are the two components that determine, where you really are. If you're 35 BMI with significant risk factors, it's the same as being obese, for example, above 40. So it was very nice to have them. So we're hoping to bring them back. This is all the time we have for today's show. Thank you for watching, and we'll see you next time.
Thank you for watching Hudson Health. See you next time.